Hello friends, this is Dr. Saira Saini again. Welcome to my office. Today the question came up, what is Daxxify? Yes, so Daxxify is the newest on the market botulinum toxin. It's Daxxify botulinum toxin A, therefore the name Daxxify. It is, why do we need another botulinum toxin? We have Botox, we have Dysport, we have Xeomin, we have neurotoxin, so why another one? Great question. All of these toxins that I've talked about already last 3 months up to 4 months in some patients. With the Daxxify, it lasts for 6 months and up to 9 months in some patients. So that's its claim to fame, that it lasts longer. It is a neuromuscular blocking agent, just like all neurotoxins. If you want to know the science behind it, it blocks the release of acetylcholine at the neuromuscular junction. So the nerve typically sends a signal to the muscle to fire, and what the medication does, the botulinum toxin, it blocks the release of that acetylcholine, so the muscle never sees the signal, so it doesn't fire, so the muscle atrophies, and it helps improve the look of the lines that are created by overuse, as in the glabellar line. So Daxxify, so that's the science behind it. If you wanted to get a deeper dive, how does Daxxify work and where did the FDA approve it? So the FDA approved it for moderate to severe lines in the glabellar region, basically the number 11 lines right here. The typical dosage is about 40 units, injecting 8 units in 5 different points. And this medication is supposed to help relieve the number 11 lines, the glabellar lines, for approximately 6 months. Therefore, patients who don't want to come into the doctor's office every 3 months with injections would prefer to come in twice a year. So this is one of those medications that will allow them to do it. It's just been approved in 2022, so it's brand new on the market, but it does have FDA approval. So that's the good thing about it. It will be available in most plastic surgery offices. Make sure you talk to your plastic surgeon to decide if botulinum toxin using the Daxxify is right for you. The people that it's contraindicated in, if you have any kind of allergy to botulinum toxin or any of the components of the Daxxify, then you should not be having this medication. And the other is, if there is an infection at the site of the injection, at the time of the injection, you should not be having this. There are a few other relative contraindications which you should discuss with your plastic surgeon before you get the injection, and make sure that you're a safe candidate to have this procedure to relieve glabellar moderate to severe wrinkles. Thank you again. As always, place your comments below in the section and I will answer them personally. I look at all the comments myself, and I really appreciate your time in listening to this video. Thank you, and hope you're having a great day.